New COVID guidelines are out tonight. The virus that essentially shut the world down 4 years ago will now be treated more like the flu. But the changes have some experts saying not so fast. CBS 2's Marybel Gonzalez joins us live now with more on what we need to know.
Yeah, Joe, we have come a long way since then. The Riverwalk even was shut down during that time. Now, this new move by the CDC, because it says COVID cases are under control, but it warns that some people should not let their guard down.
Hey, Dr. Cat, epidemiologist, you guys are smart.
4 years ago, Chicago epidemiologist Katrine Wallace took to TikTok to shed light on COVID-19. Now she's talking to us about the end of protocols put in place to control its spread, and how going forward it's being treated more like the flu.
So while every respiratory virus doesn't behave the same, adopting a unified approach makes recommendations easier for the public to understand and probably more likely for people to follow them.
Per the new CDC guidelines announced Friday, people who test positive no longer have to isolate for 5 days. Rather, they can resume activities 24 hours after they're fever-free and symptoms are improving without the help of medications. The CDC says it's making these changes based on vaccines and treatments available, widespread immunity and hospitalizations down, much like Chief Nursing Officer Christina Wagner is seeing at Sinai Chicago.
Right now, we have 2 people who are hospitalized currently, and that number 2 is vastly different from 4 years ago, where people were in the hundreds of patients that were being hospitalized and extremely sick.
Medical experts still warn this does not mean the end of COVID.
They do encourage, of course, hand hygiene, lots of hand washing, and wearing a mask in public, because you never know if you're exposing others who could be immunocompromised or maybe have other critical conditions. I think that COVID itself taught us how delicate life really is.
Now, the CDC continues recommending COVID vaccines, especially among older adults who are at risk of serious infection. Reporting live in the Loop, Marybel Gonzalez, CBS 2 News.
Thank you, Marybel.